Assalamu Alaikum wa rahmatullahi wa barakatuhu. On behalf of IAGD, I'd like to once again welcome you all here. We have a special program for you tonight. We're very honored and privileged to have two experts in the healthcare industry here with us to try to help answer some questions. No, you're being very humble, Dr. Bhatti. Three experts here to answer the questions. A lot of questions have arisen over the past couple of weeks regarding the COVID boosters, and also more so I feel in our community, immunizing children. So what we're going to have today is we're going to try to keep it very casual, keep it an open format. If anyone has any questions, please go ahead, feel free to raise your hand and we'd be happy to direct that question. With that being said, I do have a couple of prepared questions that I feel are, if you will, FAQs, just frequently asked questions, to try to answer some of the questions that some of you may already have. So with that being said, if you could have everybody once again please take your seats, we're going to go ahead and get started. I'd like to start off by addressing the first question to Dr. Jikaku. So one of the questions that has been asked here at IAGD particularly is, sounds relatively basic, but I think it's important that we cover it, and that is, regardless of whether we've gotten the J&J, Pfizer, or Moderna, is there a period of time that we have to wait before we go ahead and proceed with getting the booster? And is there any differences between the three vaccines as to how long that waiting period is before we go ahead and proceed with pursuing getting that booster shot?
Assalamu regarding the question of how long you have to wait between your first set of vaccine and a booster is usually arbitrarily fixed at 6 months for Pfizer and Moderna. For the Johnson & Janssen is 2 months. But I want to make sure that you all understand that's based on data that says that at about 6 months your antibody level starts waning off and breakthrough infections start coming. So that's the reason, but if you want to get within 2 months, it's fine, it'll give you a boost. It's just a matter of economics that you don't want to use too many vaccines and spend all the vaccines in the world for us and not have anything for the poor people. So the 6 months is kind of not fully data driven, but there is some reason for that. But for the Johnson & Johnson is 2 months. So one vaccine and then 2 months. Sure. So and the effectiveness is pretty good actually in all the three vaccines. So doesn't matter what you had in the past, you can take whatever is available if you are having trouble getting it.
Sure.
I hope that answers all the questions. If there are any other questions regarding this, I'll be happy to answer.
So just to follow up on that, Dr. Hafeez, I direct this question to you. Another question that keeps coming up is, now we're talking about boosters, but I guess the question a lot of people have is, why are we talking about boosters so quickly? I mean, it's just been really within a year since the first series of vaccinations rolled out in January. So one of the apprehensions a lot of people have is, we just got vaccinated within the past year, and now we're being asked to take boosters in a relatively short period of time. So the question really is are these vaccines as effective as they're proclaimed to be? And should we be expecting to once again have this conversation about getting another round of boosters 6 to 12 months from now?
Assalamu Alaikum. Thank you for the question, Dr. Huck. So we have to remember that vaccines are there to protect us. However, vaccines are not 100% effective. There is no vaccine out there that will protect you 100%, right? So with that being said, we have to realize that you can still get COVID even if you've had the COVID vaccine. But with these vaccines, we know that they protect you against hospitalizations and death. So realize that you may still get COVID, but the likelihood of you being hospitalized and dying from COVID is pretty low. So these immunizations do work. But as time goes on, we have noticed that people that have had the COVID vaccine and those that have not I should backtrack that we have noticed that people are getting COVID more and that the rates are increasing. And that's for many different reasons. One being that the vaccine is not 100% effective, because nothing in life is. Two is that we have kind of resumed back to normal, right? We're going out and about. People are not wearing masks as often as we did before, so that's also contributing to it. And then when they looked at the data, they looked at the numbers pre-Delta, so Delta is that variant that started in India, and then post-Delta, so after Delta. And we realized that the rates of COVID are increasing from that pre-Delta, the pre-Delta phase. And then lastly, there's a lot more variants out there, and that's also contributing to the rise in cases. So it is multifactorial. There's many different reasons. But that's all the more likelihood that we should all get the vaccine to help protect us.
Sure. Thank you, Dr. Hafeez. To follow back up on what you just ended with, which was mentioning the variants. So I'll address that question to Dr. Bhatti. Of course, the topic of discussion has been heavily skewed towards the new variant now that's been discovered out of I believe South Africa, and I believe Botswana is where it was first identified. And now, unfortunately, we're getting reports of cases in multiple different countries, including here, I believe, in California, we have the first case detected. And we can only imagine that the numbers are going to continue to go up. Now, again, tying this back into the focus of our discussion, which is, getting people to become comfortable with getting their boosters. The immediate response for many people is going to be, well, what's the point of getting the booster? There's all these new variants coming in from all over the world, and we don't really know if these variants are even going to be affected by the vaccines and the boosters that we have. So how would you address that if somebody were to pose that question to you? And just a little bit of detail about what we're exactly dealing with this new variant from South Africa. How virulent is it and how contagious is it? And what do you think we should be expecting over the next few months?
Assalamu Alaikum. I will directly answer that question in a moment. But first, I'd like to simply explain what is a variant and how do variants happen in the first place. So when a virus spreads from one person to another, that virus copies itself inside of the person that is receiving it. So when you have COVID or you have RSV or you have the flu and you cough on someone else and they breathe it in, so that virus replicates or copies itself inside the body of the person receiving it. And invariably, when you have that process happen amongst millions and millions and millions of people, that copying process can have mistakes or errors, what we call mutations. And so when the virus has all of these opportunities to mutate, it's just a matter of time before these mutations become clinically significant and where the structure of the virus fundamentally changes. So the way to stop the variants from happening in the first place, the way to stop the creation of new mutations, is to get the vaccine and to wear a mask. I will be that person today, and please forgive me, 10 to 20% of the people during the Isha prayer here weren't even wearing a mask. And I just had a patient in my hospital, at Sparrow Hospital in Lansing, 28 years old. 28 years old, no pre-existing health conditions, died from COVID in the ICU. So if you are here, parents, with those young folks that aren't wearing a mask, if that's your kid, you should tell them to put the mask on. It's not a necklace either. Like, actually cover the mouth and nose.
That's right.
So I'll answer the question directly. So if we wear masks and if we get the vaccine and we reduce the spread of the virus from person to person, then we reduce the opportunity that the virus has to create new mutations. Now, when new mutations do happen, eventually what scientists and doctors are afraid of is that the surface protein that's on the virus that the vaccines target, that surface protein might fundamentally change to the extent that the vaccines would no longer be effective against the virus. That's what we're afraid of. And we don't know whether this Omicron variant will be able to evade the vaccine, but what we do know about the new variant is that it has over 30 mutations on that surface protein that the vaccines target. And so, God forbid, but it's just a matter of time potentially before we have to invent a new vaccine because the virus mutates to the extent that the vaccine's no longer effective. So that's what we're dealing with. There's actually 10 states I just saw in the country that have identified cases of this new variant. And we don't know. We need at least 2 weeks to understand the data regarding, is it more transmissible than the Delta variant? How much more transmissible? Are the symptoms similar to Delta, or are they more dangerous? We just don't have those answers yet. But what we do know is that if you get the vaccine, including the booster, you're giving yourself the best chance of survival, God willing. That's what we know.
Just to add to the protection of vaccine versus unvaccinated is to the degree of 1 to 40 approximately. So the vaccines have done a hugely successful job in preventing millions of deaths. Worldwide, 5.2 million are claimed to have died from the virus. I can tell you in India, which claims only 400,000 dead, it's really 4 million, is hugely underreported. And the protection this vaccine gives is much better than most vaccines we've been taking all throughout our lives. The pneumonia vaccine only about 70-80%, the flu vaccine about 50 to 60%. So this 90% for 6 months is gold. So I think we shouldn't have any hesitation in taking it, if that's the message you need to get today. And I totally concur with you that don't lower your guard, because you don't know what the mutations are and what new other mutations come. So just, we may spend the rest of our lives like this, and we have to be prepared for that possibility even. Or sometimes like the flu, the Spanish flu, they call it Spanish flu, it's not a Spanish flu, abated itself without anything, and then became a mutation every year. So it killed like 50 million people or something, or more than that, I don't know exactly. This is 1910s or something. So the viruses have strange properties, you know. I don't know why India is not devastated, or Pakistan or Bangladesh. So it seems to like Western countries and more wealthy countries for some reason. But there's also huge underreporting.
And also, every respiratory virus, metapneumovirus, RSV, influenza, COVID, every respiratory virus spreads more readily in cold temperatures compared to warm. That's why we have a flu season. That's why September to like April is considered flu season, and why people don't get the flu in the summertime, because the virus is spread more easily in cold temperatures. So now is when we're really getting worried, when our hospitals are getting the most full, and it's just getting started. Winter is just starting.
So, Dr. Hafeez, I'll just pose another direct question to you that I think we all hear routinely in our practices too. Well, I already had COVID. I don't really think I need the vaccine or a booster because I have natural immunity, and they'll cite reports saying that natural immunity is as good, if not better, than getting the vaccine. How would you reassure people, the general population, that despite getting COVID, it's still essential to consider getting vaccinated?
So when we look at some of these studies are pretty strong that the vaccine provokes a strong immune response, and that immune response is actually longer than our natural immunity. So with that being said, even if you had COVID, you should still get your vaccine. And the question always comes up is, what vaccine should I get? And what I always tell patients is the best vaccine is the one that's available. Okay, we are so blessed in this country that we have access to 3 vaccines, whereas other countries do not have that. And you're lucky to even get 1, if at all. And so, you know, for the most part, they are very similar. There's some slight differences, but the best vaccine is the one that's available. Yes, I just wanted to add that comment.
I'd like to follow up on that too. Just like immunity from vaccines eventually wane, immunity from natural infection also naturally wanes. So if you happen to get sick from COVID, especially in the early stages with the initial variant, the Alpha variant, that was a year ago. So if you got COVID a year ago, the amount of antibodies that are left over in your system now are very few. And that's why we're seeing reinfection rates picking up. And so whether you got immunity from a vaccine or you got immunity from the actual infection, the immunity is going to wane over time. And that's why we need to boost ourselves with these vaccines periodically in order to increase the amount of antibodies in our system to give ourselves the best chance to fight this off.
And I wanted to add too that this is something that we already do with other vaccines, right? So there's the meningitis booster, there's your tetanus booster every 10 years. So this is not a new concept. Your immunity wanes, you need to get a booster.
Sure. Tying into that as well, Dr. Chicago, I know you take care of a population of patients that have a lot of chronic underlying medical comorbidities. I personally have been asked, well, I have all these underlying conditions, I'm immunocompromised, and I don't think I should get the vaccine because I might mount an adverse reaction to it. How do you reassure people that are immunocompromised, chronic kidney disease, diabetes, COPD, etc., that it is not only safe for you to get the vaccine, but more essential for you to get the vaccine?
Well, the answer is rather simple. If you are more at risk of getting devastating consequences of getting the infection, it behooves you more to get the vaccine rather than avoid it. There was some hesitation at times because some rare instances of autoimmune diseases have been reported after these vaccines, but all immunosuppressed patients, immunocompromised patients, patients with chronic kidney disease, chronic diabetes, obesity, they're all at high risk and they should get the vaccine. And in fact, we have recommended that our transplant patients get 3 doses of the vaccine initially, even before the booster, and then a booster again. And if it's Moderna, I think they can give you a double dose rather than half dose. So absolutely, the immunosuppressed patients should get the vaccine. Unfortunately, the people with heavy immunosuppression like transplant patients or patients on those medications like cancer drugs, etc., don't mount an antibody response as vigorously as they should or they cannot. Personal example, my brother last year, or this year earlier, died. He was on mild chemotherapy. He got 1 dose of Pfizer, got the virus. He took his mask off in somebody's house to eat, and there was a case there. And he died in February. So it is really, really important for the people with chronic kidney disease to be extra vigilant. Take your booster, take your 3rd shot, but don't lower your guard because you are at extremely high risk of very devastating consequences.
If I may, if you have a weakened immune system, what might happen is that you won't mount as strong of an immune response to the vaccine, which means you won't get as much benefit from the vaccine as somebody with a healthy immune system. But it doesn't mean you shouldn't get the vaccine. In fact, the only absolute contraindication, which means the only absolute reason to not get the vaccine, is if you're allergic to one of the ingredients in the vaccine, like polyethylene glycol. But that's exceedingly uncommon. So folks who have weakened immune systems who are afraid of the vaccine, I would politely suggest that if I was in your shoes, I would be much more concerned about actually getting sick from COVID. Because I think amongst my patients, the way that I'm able to alleviate fear is by simply taking 30 seconds to explain what the vaccine is. Because all the vaccine is a protein. The vaccine is exposing your body to a protein. And this protein is found on the surface of the real COVID virus, so that your body can create memory cells or antibodies against that protein. So in the event that you're exposed to the real virus later, your immune system will recognize that protein and attack it. So when I explain to my patients that all we're doing is exposing your body to a harmless protein, I can make people feel more comfortable with getting it.
One more thing is, of course you should ask your doctor, but the patients who are immunosuppressed with medication, if there's a possibility of you coming off of it for 2 weeks and then take the booster, might be more effective. So, but don't follow my advice just right now. If somebody is here, ask your doctor, but that's a possibility. But that's what we are recommending to some of our patients. Like for example, if somebody is going for a transplant, we say, take the vaccine before transplant, afterwards it's not going to work. If somebody is on mild immunosuppressive medication for one of the diseases, we say, come off of it for 2 weeks, take the vaccine and go back on it. So that's one recommendation that you can benefit from.
So I'd like to actually transition and talk a little bit about the kids situation. It's obviously a topic of great interest in our community, and I'll pose the first question to Dr. Hafeez related to children under the age of 18. Very basic question is, do the kids really get sick from COVID, and is the risk versus the benefit, where do you put the risk versus the benefit of getting vaccinated, and what are statistically the facts regarding how kids have dealt with COVID over the past year and a half or so?
Thank you, Dr. Huck. So if you look at the numbers, there's been about 2 million cases of COVID in children. So can children get sick from COVID? Yes. Can children die from COVID? Yes. And can children have long-term complications from COVID? Yes. So in life, you always have to weigh the risk versus benefits. And the risk of getting COVID and having complications from COVID outweighs the small risk of a side effect, which may be a fever, body aches, sore throat, right? So we're weighing the risk versus benefits. And the numbers are clear. Children should get their immunizations. There is another concern for a multi-system inflammatory disorder in children that we are seeing with COVID, where all of their organs basically become inflamed, and then they're in the ICU getting, treatment done. So, children are affected by this. And the other thing is that children can pass it on to other adults, right? So if we don't vaccinate children, then this will continue to spread, not only in the homes, but also in the schools.
Sure. Did you want to follow up?
Yeah, that last point is beautiful, because that is one of the points that's in my mind that's most vivid. It is not necessarily the case, well, let me say it this way, it is absolutely true that kids don't die from COVID as much as adults do. Nobody argues that. But children and teenagers are vectors of the disease. They can get it, they can breathe it in just as easily as you and I can, and they can spread it to mom and dad and grandma and grandpa just as easily as I can. So if you immunize the children, you can decrease the transmission of the disease amongst vulnerable adults. That's one of the main reasons to vaccinate the children. Yes, we want to protect the children themselves from disease, and children can get sick and children can die too, but we also want to protect the adults. That's a very, very important point that I can't underscore enough.
About a decade or so ago, we had a lot of apprehension with kids and the HPV vaccine, right? So I think we're seeing a little bit of that now. how would, I'll pose this to any one of you three, myocarditis, pericarditis are all things that are coming up as points of discussion. They come up in the media. Parents get very apprehensive about it. So how would you reassure families that the vaccine is fundamentally safe?
Easy. Every respiratory virus causes myocarditis at rates much higher than the vaccine. The risk of myocarditis in young people is about 16 to 30 out of every 1 million people who get the vaccine. And every respiratory virus, including COVID, causes myocarditis at much higher rates than that, number one. Number two, almost all cases of myocarditis in children from the vaccine were mild, did not require hospitalization, and spontaneously resolved within 2 to 3 days. So that's myocarditis. But myocarditis from respiratory viruses themselves, much more common to lead to hospitalization and to bad outcomes.
So, Dr. Chikaku, a lot of parents say, well, we just want to kind of wait and see how things go. What would you say to parents that say, we want to just wait and see how the next few months go? Would you tell them, yeah, you could do that? Or how would you convince them, or would you convince them that don't wait, get it now?
This is a tough task because I have relatives I cannot convince. And they're educated relatives, they're not crazy. It's a tough job. It's kind of in the public mind, it's a new vaccine and you're playing around with mRNA and DNA, and they don't understand the full implication of what that means. So it is educating and facts. Facts like Farhan said, the chance of you getting a COVID-related serious side effect far outweighs any potential side effect from the vaccine itself. And it does not cause any problem with your future, it doesn't change you into a beast or something like that. Of course you can't say stuff like that, but it's just a matter of just putting the numbers together. I'll give you some numbers. It's nothing to do with pediatrics, it's just general. The cases of anaphylaxis is 2 to 5 per million doses. It's extremely small, okay? Deaths, about 10,000 deaths have been ascribed after vaccine, okay? And I want to make sure you don't go out from here from 10,000 in your head. If you take the nursing home population of, let's say, Detroit, and let's say 100,000 people are in the nursing home, every week, let's say 100 people die, okay? So if you go there and give vaccine, maybe 101 will die, right? Now you jump to conclusion and says 101 people died from vaccine. Only one died, okay? I'm just giving you an example. So you have to be careful in what you read into these reports that come out, okay? So the total number of really deaths related to that thrombocytosis, thrombocytopenia syndrome is 6 out of 459 million doses, okay? That's in the United States. The Guillain-Barré, which is like your nerves are inflamed and you might become weak, and that's unique to J&J, 16 million doses, 268 cases, most of them recovered, very few had serious side effects. The myocarditis and pericarditis is 1,949 cases out of several 100 million doses. This is the side effects from that. How many people die from car accidents in this country? 36,000 people, okay? Do you stop going in the car? Okay. How many people die from lightning? So one of the highest causes of natural deaths. You don't go into the basement every time there's a lightning, right? So you have to look at it from an angle of risk and benefit, and absolutely there should not be any hesitation in accepting vaccines for your kids too. And there's data, and I don't think anybody is trying to hide stuff here. There's, CDC has a website, you can just go and get it and enter any issues you have. So it's all open in the, in this world. Nothing is, everything is transparent. All the side effects are, tabulated, and data is driven by various agencies. So you can't have a conspiracy of hiding anything here. Okay. So the John Hopkins has its own data. The WHO has its own data. So it's hard to cover up stuff in this country. I know they cover it up in India. That's different. Okay. So.
I wanted to add something as well. Dr. Jacob mentioned that, this technology is new, and it really is not new. They have been using this technology for years in cancer patients, where they're targeting cancer cells via the mRNA. So really, the technology is not new. It's just being applied in a different way. And a lot of patients say, well, I want to take the holistic approach. And I always say that getting vaccines is the most holistic thing that you can do. All you're doing is invoking your body to build its natural immunity, right? Versus, God forbid, getting COVID, being in the ICU, getting steroids, getting antibiotics, getting meds. How is that natural? It isn't. So vaccine is the most holistic, natural thing that you can do to help protect against COVID.
So, go ahead.
There's one more thing about children. I think it's kind of morbid in this country. Our media has done us a huge disservice because the only metric that they track is death. Well, guess what? If you get COVID and live, a lot of folks that got COVID and lived aren't the same folks that they were before they got COVID. We should be tracking that too. Because I have patients that I've had to sign short-term disability paperwork because they're not healthy enough to go back to work because they got sick with COVID. They're still having headaches, they're still having confusion, they're still having shortness of breath, they have maybe personality or mood changes, they can't sleep, they have light sensitivity and sound sensitivity because they got COVID 9 months ago, and they're still having these symptoms. So there is a such thing as long-term consequences from COVID, and children and adults can get that too. So it's not just a matter of did the kids live or die. It's what happened to the kids and the adults after they got sick with COVID. We should factor that into our decision-making as well.
One of the questions and concerns a lot of parents have that have young girls is questions regarding vaccinating girls that are not yet reached puberty. Does it have any effect on their reproductive system, fertility in the future, etc.? Can you reassure parents, Dr. Hafeez, and do you have any data or anything to suggest that there's any truth to that, or is that something that should just be clearly debunked?
As from what we know, there is no evidence that the COVID vaccine causes fertility issues. We saw the same issue that came up with the HPV vaccine, right? All of these rumors that the HPV vaccine causes infertility, and that was debunked many times over. And as far as we know with the COVID, that is the truth as well, is that there is no evidence that it causes fertility issues. There are also rumors that the COVID vaccine can result in miscarriage, and that also has resulted in a untruth, so that is not correct. And in fact, the American Academy of OBGYNs recommends that all women that are pregnant, want to get pregnant, and then even postpartum should get their vaccine. And the last thing that you want, God forbid, is if you just had a baby, right, you're in the hospital and find out that you now have COVID that you can give to your newborn baby. And that's that time that you have to bond with your child. And now you're told that you have to wear a mask, you have to wash hands, that you may not be able to bond with your baby because you're afraid that that child could get COVID from you, the mother. So, get the vaccine if you plan on becoming pregnant or are pregnant. And there is no truth to that statement about fertility and pregnancy.
I want to piggyback on that. Not only is there no truth, but if you think about what I just explained a few minutes ago, about how the vaccine works. It's scientifically impossible for the vaccine to cause infertility, because what did I just tell you the vaccine was? The surface protein on a virus. So it's scientifically impossible. It's not just a case that there's no evidence, but maybe. It's not just as there's no evidence, it's scientifically impossible for the vaccine to cause infertility. Those two things just cannot be linked if you understand the science about how the vaccine works. Number one. Number two, you know what does impact pregnancy outcomes? COVID-19. Because we have folks, women who are pregnant in the ICU on ventilators, and they have to have emergency C-sections because they're sick with COVID and they're crashing. And we have to get the baby out and hope that mom lives. That's a real thing. And it's not just one or two cases. The number of women who are pregnant who got COVID that went into preterm labor, it's not an insignificant number. So absolutely, if you're pregnant, the best thing you can do is get the vaccine, because then you can actually share those antibodies with your fetus, with your growing baby. And then if you breastfeed, those antibodies are also passed through your breast milk.
A real thing that we face is when people come into our offices, they're due for routine healthcare maintenance, multiple different types of immunizations, Tdap, pneumonia, shingles. Is it okay for people to go in and get their shots at the same time they're getting their COVID shots? Or would you advise, and this is open to all three of you, or would you advise people when they're getting their COVID shot, initial series or boosters, that they should hold off on getting a, whatever it may be, a tetanus, pneumococcal, shingles vaccine? Would you, and especially with the children, they're always due for multiple different immunizations. Would you recommend parents suggest waiting when they're getting their COVID shots, or is it okay to get them all at the same time?
I don't know, for adults, there is no problem. I don't know about the kids.
There's no problem for children either. When you show up with your well child, I'm a family doc, so I take care of adults and children. So we provide vaccines in my clinic. So a 2-month-old comes for their well child appointment. Guess what? They're due for a bunch of vaccines. And the parent asks, well, gosh, is it safe to give my baby 5 vaccines all at once? Is there some problem with that? And the answer is no, there's not. Because the vaccines are doing different things. And so it's completely okay. You might have heard in the news when the COVID vaccine first came out, they said wait 14 days before you get a different shot. Or the reason for that was simply because we wanted to do a good job of tracking side effects.
Right.
And so if you got the tetanus shot and the COVID shot at the same time, and you got some purported side effect, we wouldn't know which one to blame it on. So for statistical data keeping purposes, in the beginning, when vaccines first came out, they said, get the COVID vaccine by itself. We no longer have that concern. We're in the heart of flu season, and guess what percentage of Michiganders up until now have gotten their flu shot? 30%. That's terrible. 30% of people in Michigan have gotten their flu shot. We're already in December. So there's absolutely no reason to wait. You can go get your COVID shot and your flu shot at the same time.
No question, nothing to really add to that.
So, with that being said, we'd like to also open it up to the audience. If anybody in the audience, go ahead. Or just raise your hand and we'll call on you. Go ahead. Awesome.
2 questions. You mentioning about kids getting the vaccination is important because, they can transfer these to other people, adults and grandparents. But what I've heard, and that's the reason I'm asking, is regardless if you take the vaccine or not, so it's better to take the vaccine, but if you have a vaccine, you can still pass on to anyone. The second question is, in Michigan, the patients that are hospitalized right now in serious condition, what is the percentage of those people are vaccinated, or who are not vaccinated, and the people who die, most of the people are dying because they were not vaccinated, or there are cases with the people who were vaccinated?
Great questions.
Can you just recap the question?
The first question was, Yes, transmissibility, sorry, my ADHD is great. So the first question was, can people who got the vaccine still transmit it? The answer is yes. But the vaccine was never intended to eliminate transmission. That's a fallacy. The vaccine reduces transmission. And the vaccine also protects against hospitalizations and deaths. So the second question was, how many people in the hospital right now with COVID are unvaccinated? Well over 80%. And the people who are vaccinated, who are in the hospital with COVID, tend to be people who have underlying health conditions, they're immunocompromised, they have cancer. General Colin Powell was fully vaccinated, he died from COVID, but guess what? He also had multiple myeloma and was receiving cancer treatments. So his immune system was weakened. So the people who are dying from COVID overwhelmingly are unvaccinated. In fact, if you're unvaccinated, you're 14 times more likely to die from COVID than a vaccinated person. Hospitalizations, if you're unvaccinated, you're 11 times more likely to be hospitalized than a vaccinated person. You're welcome.
I also wanted to add, Asapai, that if you get the COVID vaccine, realize that the COVID vaccine is not live. So you cannot get COVID from the COVID vaccine, and you cannot spread COVID from the vaccine. I don't know if that's what you were asking, but that's how I interpreted your question. That you can. So again, you cannot spread COVID by getting the COVID vaccine because it's not live.
Wait, I wasn't thought of that, but that's a good
Okay.
point. Thank you.
Go ahead.
Here comes trouble.
Vaccines are tested for many years, 3 years, 4 years, 5 years at least. And we have this vaccine just came in 9 months only. What will happen after 3 years from now to start to see real side effects? And another question, frankly.
Jazakallah khair, brother. His question was, the other vaccines, their clinical trials seemingly were longer. This vaccine came out in approximately 9 months. How do we know that 3 years from now we won't see some rare side effects? So I have several answers to that question because this is one of the most common questions that patients understandably ask. So the first answer is, let's go back to how the vaccine works. So the vaccine is giving your body an mRNA code which tells your body to create this protein. This protein is found on the surface of the virus. Then the mRNA is destroyed within the cell. So scientifically, there would be no reason to expect that there would be any possibility for any long-term side effects based off of how the vaccine works. So that's the first answer. The second answer is that the vaccine technology wasn't actually developed over 9 months. The mRNA technology that they used to make this vaccine has been around for 20 years. And it was the same technology that they were using to create a vaccine during previous outbreaks. If you remember in the 2010s, we had MERS outbreak. Remember MERS? They were using mRNA technology to create a vaccine for that. But then by the grace of God, that pandemic ended on its own. So we didn't need a vaccine. But they were ready. They were going to use that same technology to address that pandemic too. So the idea that this technology came out of nowhere and in 9 months we got a vaccine, that's also not correct. This technology has been around for a while. A long time, and they were even using this technology to research other vaccines for other pandemics before this one.
Yeah, go
I
ahead.
just wanted to ask, why was Pfizer recommended for kids under 18 and not the other 2 vaccines? Like, what was behind that?
Great question. The question for you watching at home is, why did Pfizer get approved for children? Well, what about Moderna in children? The answer is that the first company, at least the first US company, that began developing the vaccine was Pfizer. So their vaccine came to the market first, and their clinical trials have been running the longest. So they had the opportunity to have their data for children come out sooner than the data from the Moderna clinical trials related to children. The data for Moderna is coming out now. Moderna says that their vaccine is also safe and effective in children, but because those trials haven't been going on as long as the Pfizer trials were, Pfizer was able to cross the finish line first. But it's just a matter of time before Moderna is also approved for children. We're just waiting for the trials to finish.
Go ahead.
We've been asked to get the boosters now. So how long is the booster effective for? And are we looking at yearly boosters, just like for the flu? Is that something that we have to?
Well, nobody knows what's going to happen. Like I said, these are viruses that mutate, and then if it is like a flu virus, you're going to get stuck with this for the rest of your life. But there are other viruses like Ebola and all that stuff just went down, and alhamdulillah, nothing has happened. But it looks like this is a different animal altogether. So it's hard to predict, but my own feeling is being stuck with this for the rest of our lives.
My answer to your question is that we are probably going to need boosters in an ongoing basis. What the time interval is to be determined. So is it going to end up being like a flu shot where we do it once a year? Is it going to have to be every 6 months? That depends on many things that we can't control, including the emergence of new variants. And again, as a recap, the new variants happen because so many people have yet to get the vaccine, so the virus spreads more and creates more mutations. So if we're able to get more people vaccinated, then inshallah the number of new variants will go down, and then people will have more antibodies from previous vaccines still in their system that might be effective for a longer period of time. So we really don't know yet how long the immunity is going to last for, and if that immunity will remain robust against new variants that emerge, or if new vaccines will have to be created to address those variants. We just don't know yet.
Go ahead, you had a question?
For kids under 18, do we stick to like Pfizer booster or can we take anything?
For now, the only one that's FDA approved, so on label, is Pfizer. I think that's going to change within the next few months, where they'll be able to get Moderna once the data comes out. So if you gave a 17-year-old a Moderna vaccine, nothing's going to happen negative. It's the exact same technology as Pfizer, so that's considered off-label. So on-label, the only one that is FDA approved for under 18 right now is the Pfizer vaccine.
Another situation that comes up is I got Pfizer back in February. If Moderna is available, would you guys recommend me switching over to Moderna, or do you recommend sticking with whatever your initial series was?
I can answer that, yes, you can absolutely switch. So if you got the Pfizer before, you can get the Moderna and vice versa. You do not have to stick with one.
There's actually a study. It was called Mix and Match, and they looked at it, and actually Moderna has the strongest antibody response, 98%, and Pfizer is like 89, something like that. I can't remember the numbers. There's like 454 patients in there. So they mixed and matched a lot of stuff. So it's really, they're looking into doing that as a part of the vaccination program, is to mix and match.
But at the end of the day, if we were able to convince more people to get any of it, we'd be out of the problem would eventually fade away. So you can mix and match, it's completely safe, it doesn't matter. It's a useful exercise for you to get whatever's available to you, regardless of what brand it is. And it's even more useful for you to convince your friends and family to do it if they haven't even gotten one yet. Because that's how we get out of this thing together, is if we convince more people to do it.
Again, the best vaccine is the one that's available.
Sure, yeah, that's the right way.
I have a question along slightly different lines.
So the question was about travel. Is it safe to travel? What about booster shots for children? So the easiest answer is the booster shots for children question. Most likely that's going to happen, but again, we don't just do things on a whim. We do things based off of clinical trials. Those clinical trials are still ongoing. But if you ask me, probably within a month or two, we're going to be giving booster shots to children too. We just don't quite have the data yet, but it's on the horizon for sure. Regarding travel, none of us can tell you with certainty what travel is going to look like because we're still waiting to get more data about this new variant. Is it more transmissible? It appears to be, but we don't know yet. Within 2 weeks, inshallah, we should know, at least preliminary data about is it more transmissible? Is it more, do people get more sick from it? What's the prevalence? So if you absolutely have to travel, the bare minimum I would say for anybody watching at home would be make sure that everybody that's traveling is fully vaccinated, including boosted up. And then make sure that during the travel you're taking all the necessary precautions with wearing a mask, doing the social distancing as best as you can, those kinds of things. But, travel right now is a risky endeavor in general, even with Delta, because even Delta is much more transmissible than the Alpha variant was. But now with the new variant, and it's basically all across Europe, it's in Africa, it's been found in Australia, it's been found now in America. So we don't yet know what that means as far as how much of the effectiveness the vaccines will still have against it, if people are going to get more sick from it. I can't give you an honest answer. Maybe in a few weeks, inshallah, we'll be able to answer that question more intelligently once we have more data.
There is some politics involved in the travel thing because the knee-jerk response of clamping down, I think people and most countries are moving away from that and trying to make it more sophisticated, more detail-oriented, such as more tracking, more testing, etc. So hopefully that's where the world is going, but if that becomes a crazy virus that is really devastating, you're going to get clamped down. Politicians are not going to take any chance with this. So in the next 2 or 3 weeks, even my trip to India in January is like in the Damad over Raipur. So God knows, it's really hard.
I mean, the idea of the emergence of the South African variant, actually, the proof in a sense is in the pudding because you have a continent of 1 billion people and only about 7% of it is inoculated. And that's what breeds the variations.
Actually, they've done studies on airline passengers. It's relatively safe in the aircraft because there is high vac filters and the air circulation is very minimal. It's all filtered. There's some study, I don't remember exactly how they figured it out. When people take off, when they're serving meals, and they take it off, they say, don't take off yours, wait until everybody's done, then eat afterwards. If you want a little bit of extra protection.
That's a good one. Any other questions? Go ahead.
I was listening and I just want to get information about this. The new variant that just came out, I was listening on the BBC channel. One of the doctors from South Africa, she was saying, yes, this variant is moving around, more people are getting sick from that, but they're not getting as sick as compared to the last one, and they are able to recover quicker than the previous one. I just heard it. I don't know if you have any information on it.
It's all speculation still. And you have to remember, in order for that variant to take hold, it has to outcompete Delta for the host. And we don't even know if it's going to be able to. Or you might remember, you might recall a few months ago we were worried about the Lambda variant from South America. That kind of died out. It wasn't able to outcompete Delta. So we don't know with the new variant if it's going to even be able to outcompete the Delta variant, number one. Number two, the setting in South Africa is much different. Only 27% of South Africans are fully vaccinated. That's horrendous. And Africa as a continent, yeah, less than 10% of all people on the continent are fully vaccinated. So there's so much more opportunity for the virus to spread, number one, and then mutate, number two. So we'll see. Nobody can tell you yet, sitting here today, about what that new variant actually means for us here in America. But inshallah, we'll be able to get that data within a matter of weeks, and we'll see. We just don't know yet. Sure.
So, my question is, what information do you have on the COVID that are used?
Say that one more, say it a little louder.
COVID pill, the
COVID pills.
COVID pill? Well, Pfizer came out with that pill, which is blocking the mRNA from replicating itself, and seems to have fairly good results in reducing hospitalization and death. I can't remember how many people are there in the trial, maybe a few hundred. You remember any details? No. So it looks pretty good in early cases, so that, like, if you're exposed and you have a little bit of symptoms, hit it hard, like we give antibodies now for immunocompromised patients. So it has to find its niche, and I don't know exactly where that niche is. I think we're all going to use it, and whether it's indicated or not. So it's kind of like still not very sure. I don't know exactly how it's going to fit in the armamentarium. It's going to have some place there. I can't tell you a little more than that.
What I've seen thus far is like up to 60% effectiveness from that pill. So it's not as good as prevention. Prevention is still the best cure. But if you end up risking it, you remain unvaccinated, you're in the hospital, you're on the verge of requiring a ventilator, we're going to throw everything at you. We're going to give you antibodies if we've got them. We're going to give you this pill of, we're going to give you Decadron. We're going to do all of this stuff. So it's another tool in the toolbox. But it would be nice if we never had to use it. And how often we need to use it will depend on what the vaccination rates end up looking like.
Okay, I think that's just about, Ms. Arbor, did you want to say anything? Well, thank you all for coming tonight.